We're lucky enough to have broken into one of our MP's evenings. Dr. Ayesha Verrall, Labour Party spokesperson on health, joins us live. Ayesha, thanks for joining us so much.
Hey, thanks for having me on.
So we've got you for a tight window. So we'll do all those niceties with our whānau later, and we'll just get into a conversation with you now, if that's okay. We've obviously got you on today because we want to talk a little bit about the whole conversation around the new Health New Zealand Czar, the sacking of the board, and what National is, well, I guess the National-led government is telling us versus, well, I guess, is it true? I was going to say versus the truth. I should hold a little bit of my opinion back. I would like to know from you, please. We're being told by this government that this is the biggest spend there's ever been in health in New Zealand. And watching Breakfast this morning with Mr. Lux and we're going to play this clip later on, he says very clearly, as an answer to being challenged, the question he got asked is this a case of overspending or underfunding? And his response is, there's never been more money spent in the health system as there is by us today. So his response is it's not being underfunded. He never actually answered the question. He said we're giving more than there's ever been given. Other aspects like the CTU seem to be coming out saying that is technically true, but because of inflation, that more money is buying less. I just want to throw you the ball. If you want to speak for the next 12 minutes on that, you're more than welcome, and get your thoughts around what we're seeing and what the truth is in between all of what we're seeing.
Yeah, thanks very much. And it's been just over 24 hours since the government launched a political attack on the Labour Party, the Health New Zealand board, the health reforms, and started spinning all these, well, let's call them lies, because that's what they are. So every year we have to spend more on our healthcare because of inflation and because of population growth. That's been really big in the last year due to migration. We have to spend more for our health system to be able to deliver the same service. So, of course, every health budget should be bigger than the one before. That's not in and of itself an achievement. And one of the things we tried to set up when we did the health reforms was sustainable funding of the health system. So the principle that for the health system to be able to plan, to be able to not lurch from one funding difficulty to the next, it should have a funding track that accounted for its growing cost pressures, inflation, and population growth. So we agreed that. We published the information for it before the election in pre-fu, so that all parties could plan for what they needed for the health system to go. The National Party funded what was in that estimate, what was in pre-fu, but we know their budget was really tight because they also made those ridiculous tax promises. And then when they were advised by health officials after the election that inflation and migration, their costs were higher than what they thought pre-election, the national government didn't adjust that funding to keep up with inflation, with the cost pressures that Health New Zealand has. So in real terms, every New Zealander has a health funding cut, and the CTU has calculated that it's 4% less is being spent on every New Zealander once you account for the increasing costs with the budget that's just been.
Let me read this from the CTU. This was a press release they put out around the budget. Nominally per capita, operational expenditure on health fell by 1.3%, and real per capita expenditure, i.e. adjusted for inflation, fell by 4.5% on current population projections. That's what you're talking about?
Yeah, that's it. Yeah.
So how did you guys mess up so badly to ruin their numbers? Because it seems to be all your fault, Ayesha. Apparently the blowout from you has ruined their calculators, and we're trying to figure out why you did that to National.
It is a recurring theme that they fail to take responsibility for their own poor choices, their prioritisation of landlord tax cuts over and blame all of that on basically anyone but them. But the responsibility is squarely at their door, and they've tried to fudge the picture also by saying that the reforms baked the problem in, but the reforms were designed to create sustainable funding. And the other thing is in the cabinet paper that accompanied this decision to appoint the commissioner, they also revealed that it all came out in the February accounts for Te Whatuora. So how on earth you can impact that from the previous financial year is beyond me. And they blame it on costs going back to 2018, which is ridiculous.
It's the same when they made that strange argument about fiscal cliffs, isn't it? When they said fiscal cliffs, what they were saying is, well, the funding has been programmed out till the halfway through this year, and then it needs to be reprogrammed. For some reason, they sold to the public, and credit where credit's due, they managed to, that the previous government didn't fund enough for the first term of the new government. When who would ever do that? You fund to the end of your term and a bit more, and then it's up to them to refund. That's sort of the same thing, isn't it?
As a political tactic, it's exactly the same. It's blaming the other government, not taking responsibility for their own decisions. But there's also more to it, I think, in this particular situation. They didn't just blame us, they blamed a board of talented people who, whatever you who have come from a range of diverse backgrounds, who put themselves forward to act in public service for New Zealand and take on a really difficult task of running our health system. They blame them as well, which I think is particularly despicable. And then they've also cast blame at management, who of course are public servants and can't defend themselves. So all around, I think it's pretty petty, small-minded managerialism from Chris Luxon's government.
Chairman Chu, you want to jump in?
Should we draw any particular angles in the fact that their chairman has been a very strong proponent of private healthcare in the past?
Yeah, look, I guess on principle, where I'd start with that is this is the government's responsibility. I hold Shane Retty responsible for everything Lester Levy does in this role. I think you could, I notice some commentators were blaming the Ministry of Health today. The government's trying to cast aspersions about the board. I don't really want to play the man with Lester Levy. It's what he does in his role that I think is really important. So running public health services into the ground in order to justify privatisation, we can't have that. However, I also want to be real with you guys. Our health system is incredibly privatised. General practices, many of those are private providers. They're not all for-profit, but they are private. Laboratories, hugely privatised. Radiology services, private. Aged care, private including charities. So we really have the hospitals and specialist services are the most public part, are the remaining public part of our system.
He's also saying the right things. I mean, I saw a clip from a press conference he did where he was talking about waiting lists. Of course, we all want to get waiting lists down, but Ayesha, forgive us, and I'll throw Chewy under the bus with this as well. We struggle when we hear this government using the right words, like we're all equal, because it's the underlying thing they're doing with those words. So when I hear an appointment from the government, a czar, if you will, who's been put in place above and beyond the board, using words like waiting list, I'm like, that's the right words, but they often, this government, say the right words, and there's an underlining ugliness that comes with it.
Yeah, so the biggest thing in this announcement is they have used a manufactured crisis as a justification for a cost-cutting program. And I think that's what all the words are intended to cover up. And for well over a month now, I've been getting emails from people in the health sector saying, I can't get my colleague who's resigned or retired, their vacancy can't be filled. Our service is at a critical position. We were approved funding for more clinicians, and those positions aren't being filled. I've heard of people going on maternity leave, and they go on maternity leave and without any guarantee that their work will be done by a proper maternity leave cover. So that's what the real agenda here is with what's been said.
Here's something else that kind of scares me a bit, because we're being told by this government $130 a month is the blowout, quote unquote blowout. Now that says to me they need to cut back $130 million a month. Now, what's that going to look like with this 14 layers we get told about? And we'll find when we play the breakfast story later on, they can't identify what those 14 layers are, but they're telling us it's 14 layers. I'd like to know from you, especially what you're hearing from people at the coalface, what is losing an additional $130 million a month from the New Zealand health system look like, Ayesha?
Yeah, well, it will mean cuts to frontline services. There is no way it cannot. It's certainly the case that we could make back office savings and efficiencies in Health New Zealand. That's part of why we abolished 20 different DHBs, to make it more efficient. But there is absolutely no way that you can cut that amount of money and not impact services. Second thing is, this frontline back office distinction is pretty arbitrary. I mean, I certainly worked in the health system last time National was in government, and we lost our booking clerks. You have to go find your own patient notes. All of those things distract you from your patients and being able to do the things you need to do. So I have no doubt that it will make the lives of clinicians and the care of patients more challenging in our health system.
I know a lot of people who work in the teaching profession, and just to give an example of the front office back room, most teachers that I know personally will say the two people you got to get on board most of all are the receptionist and the caretaker. Because the receptionist will sort out all that stuff behind the scenes that you haven't got time for, and the caretaker will come and clean up the vomit when the kid does it in the classroom. And those two roles are backroom roles. So if they hypothetically were to go, which I'm not saying anyone's suggesting that, but those back office roles were to go, then teachers' jobs immediately become harder. It must be the same in the health system.
Yeah, absolutely. And we should be valuing the contribution that those unsung heroes of the health system make to the care of our patients. I guess the other way in which I'm worried about the right things being said about improving wait times and times in emergency department and so on is all of those targets feed into a very narrow view of the health system, like it's some sort of production line or sausage factory that we shuttle people through as fast as possible, not a place where we come with our incredibly diverse needs and ask for, our humanity to be cared for and our diseases to be treated with expertise. So I think it oversimplifies things into a really sort of neoliberal model where you can just extract costs out of it.
And then you add on top of that, when you're talking about diverse needs, ripping the Treaty of Waitangi requirements out of various things and getting rid of the Māori Health Authority and stuff, and you can just see you don't have to be a genius to see the direction this government wants to take, not just the health system but the country.
And the shame of that, there's a lot of ways in which that's wrong, but one of the things that really we all saw through COVID, but I had a frontline view as Minister of Health, is much of the innovation in our system is in Māori and Pacific providers. They're arriving on the scene with better funding now, and they're thinking not how has the health system run for 100 years, but how can I solve problems for my whānau, my community, in the most effective way. So they're often the best at outreach and the best at using technology in novel ways. So I feel that is a real missed opportunity for us. And the other thing the Māori Health Authority, Te Aka Whaiora, was really great about was that shifting the curve towards prevention. They were all about that. And that's another opportunity that the health reforms really presented, that cost cutting will distract us from. Because when you're cost cutting, all you have money to focus on is that non-deferrable care, being the ambulance at the bottom of the cliff.
Yeah. Hey, Ayesha, thanks so much for giving us some time this evening. I know we've cut into your evening work schedule. We really appreciate it, but we'll let you go and get back onto the real job while we keep being clowns on the internet now. But thank you for your time. All the best, and hopefully we'll talk again super soon.
Yeah, my pleasure. Thanks a lot, guys.
Thanks, Ayesha.
Cheers.